Good morning. Namaskar. My name is Raghuram. Welcome to this webinar on COVID-19 silver lining, emerging opportunities for health tech entrepreneurship. It's indeed my privilege and honor to be part of this webinar, moderating this session with some of the, I don't say luminaries, but the people who actually have made an impact in the lives of people in the healthcare industry. I've been following each of the panelists, and it's really wonderful to have them on a very, very contentious and apt subject for today. So what I do is, before I introduce myself, I would like to request each one of the panelists to say a few words about themselves, who they are, where they're from, and also what exactly in the healthcare delivery they're playing a role. Then we'll get back and then start our the topic. So may I ask Dr. Karen to go ahead, please?
Yeah, sure. Thanks so much, Raghuram. Thanks a lot. So hi, everybody. My name is Karen. I'm based in Singapore, but an Indian at heart. Totally love going back to India. Unfortunately, because of the COVID, haven't been able to visit India. So I'm the regional business lead for worldwide healthcare at Microsoft. What that means is that Microsoft has about 8 to 9 industry verticals. Healthcare is one of them, and I lead that for the JPAC region. And at Microsoft, the role that we play is, I'd like to kind of share with you our mission statement, and that's basically to empower every person and every organization on planet Earth to achieve more. And because of that, we kind of recently launched the Microsoft Cloud for Healthcare, and we've been doing a lot of pioneering work in the area of healthcare. Happy to share more as we go along. Over to you, Raghuram.
Prashant, would you like to go next?
Sure. My name is Prashant Warrior. I'm the co-founder and CEO of Cure.ai. I live in Mumbai. My background is that of a data scientist. I've been doing data science in AI for the last 20 years. Done data science in various fields. Started with retail, consumer products, logistics, fashion, advertising, and then set up Cure.ai in the space of healthcare about 4 years ago. Our focus is the use of AI to interpret radiology images. So we interpret X-rays, CT scans, and other radiology scans using AI. And today we are in about 28 countries deploying these algorithms. Thank you for inviting me to the session, and look forward to participating.
Thank you, Prashant. I've been following the organization. I think NASSCOM has been working closely with Q.AI, and it's an impressive growth story of your startup. I don't call it startup anymore, but your enterprise, and wish you good luck. Nice to have you on board. Mr. Raj, may I request you to go through the introduction of yourself, please?
Sure. Thank you, Raghuram. And thank you for having me on this panel. My name is Siraj Dhanani, and I'm based in Bangalore. My background has been in the healthcare field for all my career, initially in the pharmaceutical domain, then in business analytics for healthcare, which is my first and previous startup based in Bangalore. And now my venture in Axel, we are working in the space of medical technology. So what an Axel does really is identifies critical unmet needs that are seen in the Indian healthcare system through very close engagement with doctors and hospitals in the Bangalore area. And over a 6 to 9 month period, identifies and sort of specifies a problem to solve. And then we develop novel technologies to address these problems. So today we have a portfolio of products in the critical care and the maternal care space, which we had just launched in late 2019. And the COVID scenario just kind of put a lot of that to stop. But during the lockdown, we also developed a product for the COVID space, which I'd love to talk more about later. So broadly, I think an Axel is trying to solve problems that we perennially see in the Indian and emerging market healthcare space, and we are hoping our products really make a difference. in healthcare delivery in India. Thank you, Raghuram.
Thank you, Siraj. Saurabh, nice to again get back and talking to you. Nice to see you again, and welcome to this panel. And may I request you
Same
to
here.
go through your introduction before we launch into our most important topic of the day.
Sure. Well, hi, I'm Saurabh. I represent Meadow. We started about 2 years back. We're actually in the space of organizing the entire outpatient care, which we believe that is actually the most important step when it comes to your care journey, because I think in India we lose 2 million people every year because of not being able to provide them timely quality care. And I think the bulk of that comes from our mindset of being able to delay care, essentially because this entire outpatient care is so unstructured, it's so distributed that it's not coming together. And I think that's the little work that we're trying to do. We are actually physical, digital, whatever word you want to use, outpatient care chain. So we have about 300 odd clinics in NCR, and we have our online platforms where you can get care or one-stop care, whether it's in terms of doctor consultations, tests, medicines, lifestyle, nutrition, products, devices, medical equipment, home care, everything under one roof. So that's essentially what we're trying to do, and using technology as the backbone to kind of fill the gap that so widely exists today. Right?
The first thing I want to ask, see, what exactly, each one of you can answer for this question. What, in your opinion, is the significant impact COVID pandemic has on healthcare in India? It's not about technology. I would like you to specifically address how the healthcare delivery in India has been transformed. Maybe, Dr. Karen, would you like to go up with maybe you can bring in some international perspectives as well?
From a not just from India perspective, but from an international perspective, one of the things that we joke about in Microsoft in the healthcare realm is that what we were trying to achieve in the last 2 years, we could achieve in 2 months. So we've been trying to convince healthcare organizations that they need to kind of digitalize, they need to kind of integrate data, be able to make sense of the data that they're collecting. And I think it always fell on probably very reluctant ears. But come COVID, we see suddenly people coming to us and saying, tell us, how do we kind of live in this kind of a new world? So I think one of the biggest impacts that we have seen is that during COVID time, of course, a lot of organizations moved to the digital world, especially in the private healthcare. But I think going forward, Raghuram, I think we will be living in a hybrid world where some would be live and some would be virtual. Now, having said that, I think given this 5 to 6 months that we've gone through COVID, there are a few technologies that have definitely come to the forefront. One is we've gotten a lot of, as you correctly mentioned, supply chain. How do I kind of digitalize supply chain? Because that was the one which was most broken. The second one is what I would say as virtual healthcare, and that involves a lot of things. It involves telehealth, it involves remote monitoring, continuous monitoring. So that was the second one. The third thing that came up was patient 360. Because you see a lot of hospitals, even in India, when I used to talk to them, you had patient coming to hospital X, and they have a subsidiary, let's say in Chennai. So you have the main hospital, let's say in Delhi, and they have a subsidiary in Chennai. And this patient who was earlier going to Delhi suddenly kind of appears in the Chennai hospital. They don't have the electronic medical record of that patient. So they're not able to see what the past history is. So suddenly hospitals realize that, hey, we really need to kind of coordinate systems across the region to be able to have that full 360-degree view of the patient. So these are some of the, I would say, the areas where we've really seen an acceleration post-COVID. And having said that, and given this topic that we have today, I do see that tech entrepreneurs have a big role to play, because no player on earth can ever give you the full solution to any healthcare problem. So I think this is where health tech startups kind of play an important role in plugging those gaps and being able to offer that full continuum. And just to share with you that Microsoft, you'll be surprised to hear, that works with almost 68,000 partners at the minimal in the global level on their healthcare and other areas as well. So this is really an ecosystem play where everybody comes together with solutions to kind of help solve that problem. And I think that has been accelerated tremendously during COVID time.
In my personal experience, I mean, I will start with a controversial statement. I mean, I think this COVID pandemic is like demonetization for health tech, and what demonetization did for Paytm and all the payment gateways or mobile wallets. This is COVID-19 is doing that for health tech companies. So I think that is a change that we are seeing. I'll talk about the basic need, right? As a patient, I mean, my dad is 70, he lives with me, and when he fell ill, I don't want to take him to a hospital. I want to be able to take care of him at home, right? So home care services, teleconsultation, all of those become very important. And so you want to be at home during this pandemic, and you don't want to go to the hospital where there is a risk. So a lot of need has come up where you want to provide that care at home. So all of these kinds of services, telemedicine services, home telemedicine, remote care, many of these services have become much more popular during the COVID-19 pandemic. And this is also something which is going to last, right? Think about it this way, that if I have to go to the hospital, I have to drive half an hour each way. I have to spend 1 hour on the road. I have to take an appointment beforehand. Even with the appointment, I have to spend probably 1 hour waiting for the doctor. So in all, I mean, a doctor's appointment is like 2-3 hours of my day. And if I'm doing that online, I'm saving probably, I mean, 2 hours and 50 minutes. I mean, it's like a 10-minute, at max a 10-minute out of my day that goes in for that appointment. So I think teleconsultation is going to be the future of medicine, and it is something which has been expedited due to the COVID-19 pandemic. And of course, that is on the telemedicine side. What we're also seeing is that from Cure, where we are providing AI interpretation for X-rays, CT scans, we're seeing a huge amount of adoption in the rural parts of the country where they don't have radiologists to read these X-rays or CT scans. And I'll talk about that more later. But I think in general, I mean, at least personally, from my experience, what I've seen is that the number of people that were using Cure before COVID over our last 3 years of history has more than doubled in the last 6 months. And that is the kind of adoption that we have seen. And I will hand it over to you, Siraj, to talk about your experience with COVID-19.
Sure, thank you. No, I agree with you, Prashant. The sort of phenomena of going to the hospital or going for physical consults, especially for routine things, is getting increasingly questioned. And we are seeing this in the maternal care space, where we have a product which is intended for pregnancy and labor monitoring. Mothers in their last stage of pregnancy after their full term need to go to the doctor pretty much every other day to check on the health of the fetus. And that today is, as you can imagine, a high-risk sort of encounter given the spread of COVID. So there is a lot of interest and a lot of push for moving some of these things to remote, to maybe home monitoring, where the mother can monitor herself and the data can be shared with the doctor for real-time decision. And I think we see more of this. I think up till now, remote access, remote monitoring was nice to have. People were sort of weighing the benefits and the convenience versus, the security of having a physical person there telling you that now is cautious of going into high-risk environments like hospitals. And I think that will really spur an increase in the remote monitoring and digitization of healthcare.
Sure, thanks. So I actually completely agree with the thoughts that have been given so far. In fact, Prashant, you kind of stole my move there, because I actually define it the entire last 6 months as the demonetization event for healthcare. But there's a couple of things that that it comes with. If you look at how the entire thing panned out, there was a huge surge, and then there was a clawback in a way. And what at least we being omni-channel are noticing is that while we had the surge towards digital, there has been a clawback. But but where it's going to settle is at least 20% above where we were, pre-COVID levels in terms of technology adoption and the preferred channels. But more importantly, I think what is definitely happened is it has opened technology up to the healthcare professionals, which somehow just wasn't getting through. And I think that's the biggest change that is, I think, going to sustain itself. I think when it comes to teleconsultations, despite the concept being almost 1 to 2 decades old, we have still not, I would say, mastered the best way to be able to provide it. And my view on why that is happening is because there was no acceptance, whether on the patient side or on the doctor side, that technology and the methodology just couldn't leapfrog. What we have right now with us is, I think, the opportunity to be able to leapfrog the communication, to be able to leapfrog the way we are going to make these teleconsultations and e-consultations happen, because clearly the intent is there. But I think we're still all doing doing the catch up to ensure that the change that we are going through is sustained through better technology, better care, honestly, because today I think there is a lot of checks and balances missing when it comes to e-consultations and overall technology. And I think everybody together is working hard to bring in those checks and balances, to bring in those quality assurance parameters, so that we can make it a better experience for everybody involved. So with that caveat, fully agree that I think it's a good, I would say, situation for us to be able to understand what all is still lacking from the system, right? Sometimes we need a rude shock for us to kind of wake up to how poorly we are conducting ourselves when it comes to healthcare.
One more important point I want to raise at this point, especially from health tech entrepreneurship perspective. We have seen a surge of a rejuvenated entrepreneurial spirit coming from many people. They repurposed themselves. At the same time, it is not able to infuse themselves into the mainstream delivery models. I have witnessed, and there are a few organizations coming forward and trying to look at a kind of a mergers, not necessarily from the acquisition point of view, trying to integrate their solutions for a more integrated approach to providing an orchestrated solution to the patient, or help the HCP, rather than trying to exist on their own. It's becoming very difficult for them. I would like to hear from you how you see the collaboration between multiple sets of health tech entrepreneurs. Has it really improved, really, as people see? Or is there any downside which is felt by some of the health tech entrepreneurs? Do you have any perspective from that side?
I think, as I mentioned earlier, health tech adoption has been extremely rapid in the last 6 months. I mean, what we have seen is really rural sites in Assam, Maharashtra, Madhya Pradesh, Chhattisgarh. They have adopted AI. They have, because they don't have people, they don't have radiologists to read X-rays. They have started using AI, because AI is assisting a physician when there's a doctor in interpreting the X-rays. So that is something that has come about. I think that what has also come about is a change in the government's perception of these technologies. So one of the first places that we deployed when COVID-19 started was the Bombay Municipal Corporation. And they were very eager to adopt AI. They worked with us very closely over the first 4 or 5 months in making AI part of their workflow, right? And I think so governments have seen that change. Definitely, the Indian government, Niti Aayog, they are working through this whole health tech platform. Something called Swasthya has come about, which is the telemedicine platform, right? So there is a lot of focus from the government on enabling health tech to scale up within the country. And also there is a need. I mean, I think the need is also been there. A lot of government entities have started using healthcare technologies. A lot of the rural entities have started using healthcare technologies. And this is something which I've seen is very unique, right? I mean, if you think about it, when the kind of solutions that we build, which is AI for radiology, you would assume that the countries like US, UK would be the early adopters for that solution. But what we are seeing is actually the need is so much higher in the rural parts of the country, and they are adopting AI. In fact, today a rural hospital in Assam is way ahead of the best healthcare institution in the US in terms of adopting AI, because the need is so much higher there. It's like the cell phone technologies or financial technologies. I mean, fintech solutions like Paytm and so on. I think fintech in India is better than the fintech in US right now. And similarly, I think health tech in India can be better than health tech in US in the current era, because the need is so much higher. The need is so much higher. Of course, there are downsides to healthcare, because you cannot, I mean, unlike a fintech solution or unlike a e-commerce solution, you cannot just build something and put it out in the market. You have to validate it with multiple hospitals. You have to have validations. You have to have regulations. I mean, it has to be cleared by regulatory bodies. So for us, I mean, we have had to get it cleared by C certified, make it C certified product. We have to have had it cleared by FDA. So we've got FDA clearance. So I think all those regulatory clearances are important, and both outside of India and within India. And you have to make sure that that product works as advertised, because if there is something that is missing, it could lead to a loss of life for a patient who is not cared for in the appropriate manner. So that is something you have to be very careful about. And I think that is there throughout, not only in the times of COVID, and something to think about as you are, especially for health tech entrepreneurs as they are building new healthcare solutions.
By the way, the collaboration over the last 6 months has been, for me personally, the highlight of how everybody is coming together, right? So, and I think if we look very closely at the problem that each of us is trying to solve in healthcare, I don't think any one person can do it alone, right? So I think collaboration is inevitable, but I think there is also huge, and I can say this today because I'm working with multiple companies together, whether it's through through SWAST, whether there was some collaboration that we did through NASCOM as well. We're all realizing how it's actually 1 + 1 = 5, right? Not 2, not 3, not 4. And I think that realization is seeping in deep and fast. I am seeing far more openness, because see, initially whenever we used to try and collaborate with each other, we were throwing around things like trade secrets and blah and blah, right? So I think what has changed significantly over the last 6-8 months is the fact that everybody realizes that we need to lean on to each other to be able to make sure that at the end of the day, the person who's most important in all of this, which is the patient, is actually being cared for in the right manner. So I think I have seen a huge shift, and I'm actually very excited by it. And I think together, there is a lot more that we can do than what we can do individually.
Maybe I'll ask Dr. Karen. You have been in the international arena and Microsoft doing a lot of work internationally. Do you have any perspective? And Siraj, maybe you also bring in a different perspective from the medical devices delivery or supply to multiple organizations. Can you please comment on the emerging healthcare delivery models in India?
Yeah, so thanks, Raghuram. So I see 4 different types of models that are emerging, and fully agree with what Saurabh shared earlier. I think the basic tenet being that the definition of healthcare is changing. Earlier, if you were to look at healthcare, it would mean just your hospitals, clinics, doctors. But I think in the last, not just because of COVID, but even in the last 2 to 3 years, it has kind of broadened. So both in India and internationally, you do see payers, that is insurance companies, playing a big role in wellness. You see retail industry coming in. You see things like logistics, for example, Grab. And I'll share a few examples coming into healthcare, basically to plug in those gaps, which we ourselves have not in healthcare been able to fix. So these 4 models that I've seen emerging, and they have definitely been accelerated because of the COVID scenario. The first one, as I mentioned, is what I call as the out-of-hospital delivery model. Hospital is no longer going to be your point of care. It's going to be your community-based care. So we do see a lot of shift of care from hospitals to homes and to your, let's say, your clinic next door or somewhere near your house. And that is where things like telemedicine, remote care, continuous monitoring, all are coming in, because you really, I think like one of the panelists shared, you really don't have to go all the way to a hospital, except if, let's say, it's for a very specialist treatment, or if it's for something that really only a hospital can do. You can get all that care in the comfort of your home and in the comfort of your clinic, which is next door. Now, this helps two things. One, it helps better care at the right moment. You don't waste time. Secondly, it also helps in transfer of skills right from, let's say, urban to rural area using technology, so that doctors, let's say, in the rural areas are also skilled and equipped enough. And in case they do have problems, they can use telemedicine, doctor-to-doctor connect. I'm not sure if you've heard of Project Echo, but that's where you kind of have skilling of urban doctors to rural doctors, so that care is given instantly. You don't have to wait. You don't have to travel. That's one. The second model that I see a lot coming up is what I call as patient 360, and what in a way it's patient engagement. Earlier, hospitals were like this: you come to me, get yourself treated, go back. I mean, it's more demand than supply. But COVID changed it, because private healthcare, many of them had, I think, occupancy rate of something like 20%, whereas in India, and I'm talking about less than 25%, when normally they would have 68%, right? Now hospital realize, hey, I have two big issues. One is patient stickiness. I need to have the patient always coming back to me. I don't want him disappearing during COVID or non-COVID times to some other place that is nearby, right? And secondly, once the patient goes back home, I still need to engage with him. Gone were the days when, hospitals would say, okay, done, my job is done, no more. Now the patient is king, right? He's going to decide, where am I going to go? Which hospital should I go to? So now hospitals realize, hey,
Absolutely.
host,
Fantastic.
I need to engage with those customers. So that's what I call it a patient 360, because now hospitals realize with all that data, I need to know exactly the whole history of Karen, right from her birth to her end. I need to have that entire story so that I can engage with her in a very compulsive way. So that's number two. The third thing, and I think I want to share this with the panelists as well. This is something that you will see probably and to tell you, it's already happening in India. We call it the ecosystem model. Now, let me give you a hypothesis, or like a made-up story. Let me give you a real story. Okay, so we have this hospital in Thailand, and I see this happening in India, and that's why I'm sharing that. I work very closely with the hospitals in India. So we have this amazing hospital, which is really very famous in Thailand, coming out and saying, hey, I need to look after the pre and the post. So they came out with this very amazing health plaza. Now, how do I get patients to Health Plaza? So they sign up an agreement with Grab saying, you bring my patients on a regular basis every 3 months and take them back, especially those who cannot kind of move and who have mobility issues. So we prefix appointments, right? So you have Grab coming in. Then you have their Health Plaza that they're building up. And you say, hey, Health Plaza, great, but I need to have a digital store. So let me get in all the tech companies, the e-commerce companies from retail. Let me get them in. So finally, end result, the whole ecosystem was having a hospital, having a logistic company, having a retail store, which is acting like a health plaza, and a few others. And this begins to grow, because you begin to kind of leverage on the strengths of each other. And then you look out and say, now comes 5G, let me get telco in. And so even in India, you will see the discussion where telco is getting it. And interestingly, like in Japan, you may even have transportation companies coming in, like Japan Railways and Japan Post, for example. They are also looking at it and saying, I have a lot of data. How can I add to that whole ecosystem and make healthcare delivery really great? So in short, Raghuram, what I'm saying is that the patient is becoming king. People are coming to the patient and building an ecosystem around the patient, and saying, hey, Karen, you have a work life, you have a health life, you have a family life, you have a social life. How can I put all the information of this around in a platform, in a data platform, and be able to engage with Karen in a very personalized fashion? So I think these are exciting times. The whole definition of healthcare is really changing.
I'd like to share a slightly different perspective, though, and that could be a function of the environment where we operate in, which is typically the sort of mid and so I won't say low, but less resource uh, available environments. And while I think a lot of what we are discussing applies very strongly to diagnosis and monitoring, at the end of the day, healthcare and especially interventional care has to be provided on the spot. And that is where I think we really cannot dance around the issue of having healthcare facilities with the right infrastructure, the right staff, and all of that. While some healthcare delivery can also move out of the hospital into the home setting, like Portia and the likes are doing, I think at a very fundamental level in India, we have a situation of skill gap. There aren't enough trained and qualified resources to deliver healthcare even in our centralized hospital-driven fashion. And while I think skills can be transferred and Doctor A can be remotely managed by Doctor B, usually if Doctor B is so good that he can remotely manage Doctor A, he probably is working 16 hours a day. So I think there is an inherent kind of gap, especially when it comes to delivering care, and that is what really concerns me. And especially with COVID, the one negative we've seen is that healthcare professionals. I mean, I respect them; they are warriors dealing with circumstances that will shock most of us. Uh, they are kind of stepping back. There is a risk of infection. There is a risk of burden. Rightly or wrongly, there is a feeling that they haven't been adequately protected. And I just worry that maybe the delivery of care uh, takes a negative hit after we are done with the COVID surgery, because doctors are fatigued. I mean, I've been in hospitals and the 3 layers of PPEs working 12 hours a day. I mean, it is bad. So, I mean, I think while there is a lot of positives that are coming out of this, I think there are a lot of concerns as well. Uh, and I thought it'd just be good to highlight.
And then I would like to kind of a quick round robin from each one of you. If you can give two advices which you would like people to take it from here from health tech entrepreneurship. Maybe I'll start with Prashant. Quick pick 2 points, please.
Two things. I will say, if you are building technology, think global, because technology, if you build in India, can be applied to any country. So think global for the technology. Second is that patient safety is very important. I think building technology is easy, making sure that you are taking care of patient safety and taking care of all the regulations that are there in healthcare. That is important.
Yeah, so for me, the first one is don't be a me too. What that means is that if there's already a solution that people have built, don't go the same way. Healthcare has so many areas where there are still no solutions. Look carefully; you will definitely see a niche. And as what you said, Raghuram, collaborate. Your solution can beautifully fit into somebody else's solution, and you can go big. You can ride on them, be like that mollusk on the whale. You ride on it.
Yeah, well, I mean, I think for the few healthcare entrepreneurs who are out building, physical systems, electromechanical solutions, let's say, for the medtech space, it's going to take time. Just recognize that it's 4 or 5 years of engineering, regulatory, all of that before you get a product out that is completely safe, to Prashant's point, and reliable. Budget for that right up front. And the other thing I would say is the whole self-reliant India and the decoupling from China may offer interesting opportunities for domestic players to create products of not even equal but better quality and reduce our reliance. And I think that's the space people should look
I
at
think
closely.
the first thing I would say is be bold, right? I think especially when it comes to healthcare, uh, everybody around us pushes us to be conservative, pushes us to be incremental. I think it's very important where we are to be able to think out of the box, to be able to experiment, and to be able to be audacious and bold with our dreams and our and where we want to be. So I think first thing I would push people who want to start up is to actually be bold about their vision, be bold about what they want to achieve, because it's a huge problem that we still haven't clearly solved. And second, I would say is, while you go about it, don't try and create everything ground up. I think it's very important to lean on. I can bring it back to the same collaboration theme, but it's very important to know what is out there and how you can use what is existing to kind of.
Wonderful having you here, the panelist, and wish you a great day. Thank you so much, and we look forward to meeting you again.